In this video, we're going to talk about injuries to our nerves that supply the sensation and motor function to our airway. Before we do that, I want to highlight the fact that, remember, you have bilateral superior laryngeal nerves, you have bilateral recurrent laryngeal nerves. So it's not like you just have one. If that gets knocked out, then it's game over. You have two. So with that being said, let's just start talking about the nerves that could get injured during surgery or during manipulation of the airway and what the effects that they have our on our speech, on our breathing, things like that. So the first thing that we're going to talk about is our superior laryngeal nerve injury. If we have an injury to the superior laryngeal nerve, that is going to depend on the extent of the injury is going to depend on whether we have unilateral injury, so injury to one of these superior laryngeal nerves, or bilateral injury, which is injury to both. So unilateral injury to the superior laryngeal nerve is going to technically have minimal effects. It's not really going to cause many problems. If you have bilateral injury, so let's just I'm going to draw an X right over here, and I'm going to write bilateral. Let's draw that one more time. Bilateral. If you have bilateral injury to your superior laryngeal nerve, what is that going to cause? So you're basically going to have decreased sensation to everything above the cords, but regarding a motor function, you're going to have hoarseness and you're going to have tiring of your voice. And the reason that you have that is because, if you remember, the external branch of your superior laryngeal nerve supplies the cricothyroid muscle, which is a tensor. And with a tensor, you're able to target the pitch of your voice. You're able to shape the pitch of your voice, and without that function, you are going to get a tiring of your voice and you're going to get hoarseness. So I'm going to write here hoarseness. And then there's also an aspect of a tiring of your voice. So that is going to happen with a bilateral injury to the superior laryngeal nerve because you're effectively knocking out your cricothyroid, both of your cricothyroid muscles. So let's see now, let's switch to this side. Let's see what an injury to the recurrent laryngeal nerve looks like. So the recurrent laryngeal nerve supplies sensation to everything below your vocal cords. It also supplies the motor function of all of your muscles of the larynx, including the all-important posterior cricoarytenoid muscle, which is the only abductor of your vocal cords. So a unilateral injury to your recurrent laryngeal nerve is going to also cause some hoarseness. So let's write hoarseness. And why is that? So the reason is because you have one side of your posterior cricoarytenoid that is injured. You have all of your other muscles of your larynx that is injured on one side. So that is not going to be able to make you organize the pitch of your voice. That's going to make you more hoarse. And if you look specifically at the posterior cricoarytenoid muscle, one of the portions of the vocal cords, because it is not abducting, it's going to be closed. So there's going to be a little bit of hoarseness that's involved because of that as well. Now, a bilateral injury to your recurrent laryngeal nerve is going to be a little bit worse regarding breathing. So far, we haven't talked about issues breathing or ventilating or exchanging. An injury over here just causes problems with your voice. A unilateral injury to your recurrent laryngeal nerve causes problems with your voice. A bilateral injury to your recurrent laryngeal nerve means you're effectively knocking out all your muscles of the larynx, including the muscle, the important muscle that opens up the vocal cords. So your vocal cords are pretty much going to be closed. So you could get stridor and respiratory distress, especially if it is an acute injury, like a thyroid surgery and they accidentally clip both, let's just say, recurrent laryngeal nerves. The patient is going to wake up stridorous. Their vocal cords are going to be closed. So that effectively could be an airway emergency, a bilateral injury to the recurrent laryngeal nerve. Now, if this injury was chronic, if it was over time, just want to highlight, then you do have other muscles that can compensate and help try to open up the vocal cords as much as possible. So you won't have as bad of a respiratory issue. You might just have a little bit of aphonia. But the big thing to highlight here is a bilateral acute injury to your recurrent laryngeal nerve will cause stridor and respiratory distress because you're knocking out your posterior cricoarytenoid muscles on both sides. So in quick summary, bilateral recurrent or bilateral superior laryngeal nerve injury, is going to cause some hoarseness. Likewise, a unilateral recurrent laryngeal nerve injury is going to cause hoarseness. A bilateral acute injury to the recurrent laryngeal nerve is going to cause stridor and respiratory distress and respiratory problems.